Nearly a fifth of India's total COVID-19 cases have been confirmed in the past month as the country is overwhelmed by soaring infections and medical shortages. More than 4,000 deaths and 343,000 cases have been recorded overnight.
35 of the 36 territories and states in India are now under some form of lockdown, although there hasn't been a nationally coordinated lockdown response to this very, very devastating second wave that on a daily basis at official levels of death tolls are around 4,000 a day. Experts believe that could be very seriously underestimated by many times, and indeed a daily infection rates of 350 plus thousand people every day, again woefully underestimated. And there's no conspiracy behind that. That is just a sign of the amount and capability of testing for the COVID-19 virus. And we've also seen a sinister evolution in terms of people's response to this pandemic, with large numbers of bodies turning up floating in the Ganges River. Officials in Uttar Pradesh, where these bodies have been located, or even resorting to putting nets in the river to try to trap them as they float down. The assumption they're making is that these are people who have died as a result of the pandemic and for whatever reason have not been properly cremated. And that's just an example of how desperate the situation continues to be. Whether you're in New Delhi here, the capital, where oxygen remains in short supply, or out in rural Gujarat or the south of the country, we are seeing a growing level of infections, increasing numbers of people dying every day, and no sign at all that this pandemic second wave has reached its full crest.